Welcome to today's Child Care Roundtable. I'm Congresswoman Kathleen Clark, and thank you for tuning in to Facebook Live as Massachusetts enters phase 2 of reopening. On Monday, we took a big step forward by reopening child care facilities and announcing new requirements to guide their operations. For many child care providers, parents, and children, this is a welcome reunion, but it's a new frontier that we are going to be exploring together. The pandemic has forced us to reevaluate safety protocols and also served as an important reminder of the foundational role that child care plays in our economy. Today, our providers in Massachusetts are working to implement these new guidelines that call for reducing class sizes, instituting new hygiene practices, building larger classrooms, and hiring more teachers. Our parents are left wondering what this means, not only for the safety of their families, but will they be able to access and afford childcare in the future? This afternoon, we are going to hear from two parents about how the pandemic has impacted childcare and what the new guidelines could mean for families. We'll learn more about the science that informed these new guidelines and how they are meant to be implemented across the state. Before we jump into this conversation, I want to recognize the role Congress must play as we look to implement these new regulations and strengthen our child care system. The fact is that the pandemic has unearthed the fault lines in so many issues, including how we provide childcare in this country. That's why I'm working in Washington to increase public funding for childcare providers and for families. I'm proud that I was able to secure $3.5 billion in the CARES Act, and $45 million of that went directly to Massachusetts childcare through the CARES Act. Further, the House doubled our commitment to childcare in the HEROES Act with a $7 billion proposed investment. And earlier this month, I joined with my colleagues to introduce the Child Care is Essential Act. This would be a $50 billion child care stabilization fund to help providers implement many of the new safety and health guidelines we're going to be discussing today. But we know this is still not enough. It is not going to be good enough to return to normal. The status quo doesn't work for families, it doesn't work for providers, and it is not working as supporting our economy. In 2018, mothers were surveyed and 40% reported they were more likely than fathers to personally feel the negative impact of childcare issues on their careers. Before the pandemic, the cost of lost earnings, productivity, and revenue due to the childcare crisis totaled $57 billion each year. This is frankly unacceptable. Childcare can no longer be an afterthought or put on the back burner. It's too important to the success of our families and our communities. And that's why I want to start this conversation from the perspective of two moms, because that's where this system truly starts, with our families. So with that, I'd like to introduce Katie Ring, who is a food and product photographer and lives in Marblehead, Massachusetts. She is a proud member of Moms Rising and mom of Brady, age 6, and Cece, age 4. Katie and her husband both work full-time, and access high-quality, affordable childcare is essential for their family. However, their childcare center is currently closed due to the pandemic. And without childcare, Katie, like so many parents around the Commonwealth and the country, has struggled to maintain her business. We are also so proud to be joined by Lynette Nieves. She is a recent graduate of Roca's Young Mothers Program and lives in Chelsea with her 8-year-old twin boys and 2-year-old son, who suffers from a health and lung condition. He was enrolled in childcare prior to the pandemic, but without childcare, Lynette has had to leave her job so that she can look after her 3 children full-time. And because of her younger son's health conditions, she has grave concerns about returning to childcare post-pandemic. I am eager to hear from these 2 credible women, and thank you both for joining us. So my first question for both of you is if you can tell me a little bit what these past months have looked like without childcare, and what is the role and why is high quality, affordable, accessible childcare so important to you and your family?
Katie, do you want to go first or will I go first?
Lynette, why don't you start?
Sure. Okay. Well, I believe high quality, affordable childcare is important. It's not just for myself, but for other parents as well, because I believe that children could receive better education, learn motor skills, self-assurance, social skills. That's one thing that I loved about having my son in childcare. It's a bittersweet with the pandemic, bitter because he was so used to being able to go to school, and I got him finally on a schedule where he didn't need to be scared about me leaving him and I'd come back right away in a few hours after I get out of work. Now just having the childcares slowly opening up is kind of a little concerned, because especially with his health issue, and then he's very lovable, very affectionate, biggest sweetheart you could ever meet. So if he goes and sees like his friends and his teachers, and then I have to leave him, he's not gonna have that comfort. Hi. I'm worried that he won't have that comfort that he would have. So that's another concern. But throughout this pandemic, I had to step in and teach him the things that he would learn in school, but at home. Hi. And it'd be a little difficult because I'm learning. I'm usually at work and he's usually in school. So it's me trying to figure out, okay, what exactly did you learn? What exactly do you know? And getting him on that schedule that they would have him on in a regular daily basis, Monday to Friday.
Yeah, yeah. Katie, what's your experience been like?
So my experience has been that we're fortunate that my husband is still working. I have been full-time employed as a mom in a corporate environment, but right now I run my own business and I've been doing this for the past 4 years. And so right now it sort of feels like I'm forced into being the one to take a step back because my business income is more affected than my husband's. My husband is able to work from home, and therefore there's a lot of stress around I have to help support him and enable him to continue working. And really the only way to do that and support my children's well-being feels like me taking a step back. And any of the days where I have a job or even I have emails to write, you know, the kids are starting to get antsy, they need things from me, and they're suffering with us both working. And I know other parents in that scenario, when both are trying to work and kids are really, you know, you're giving them a screen or a worksheet or a snack, that's not sustainable for everybody, and everyone suffers in that environment. And so I have a lot of feminist issues with, like, here I am, like I've built a business and I want to continue working. I love my job. And really what feels best for the well-being of my family is for me to take a little bit of a step back here, because 2 parents tied to computers and working, just, it doesn't happen. And even today, my husband took a half day from work so that I could come to my studio and talk to you, because I knew otherwise I would be pouring Cheerios out one hand and passing out workbooks and crayons. And, you know, how can I have an intelligent conversation as I'm trying to do 1,000 things? It's hard to talk to you. It's hard to talk to my clients. And so this environment isn't working. And for me, in terms of the return, I'm really worried because it took me a long time to build my business so that I could afford my childcare. And I started only working 1 day a week and being home with my kids 4 days as I built my business. And I was up to full-time childcare 5 days a week, a kindergartner and a preschooler. And now I don't even know what childcare to arrange. I have some clients who may have projects coming in, but I can't commit to and pay for childcare when I don't know if I'll have the work to support that. So it feels like this pandemic is really forcing me to take a huge step back. I'd made so much progress and really was running a business I was proud of, and now I don't know what that's going to look like. I don't even know what school is going to look like in the fall, if it'll be full time. So I'm not sure how to do what's best for my children, for my family, and for my business right now. There are far more questions than answers.
Yeah, and go ahead, Lynette.
Sorry, that was another concern for me too, because I was working in Boston and then they shut down school because kids couldn't be in school. Then they shut down the daycares after that. And then my job closed after this pandemic. And then it's like, okay, they're starting to reopen up slowly, but how is it going to be possible? And especially I vouch for the parents that do have vouchers. Their concern is, do I still have a voucher? Is my voucher expired? Why is my daycare not letting me know? Or they'll send us huge emails and the kids have to 2 years and up have to mandatory wearing masks. I don't know if any other 2-year-old or, because my son's 2 years old, I don't know how he would stay with a mask for at least 5 to 6 hours the whole entire day, not being able to go next to his friends. And then if it's just 2 or 3 teachers in the classroom, how are they gonna have at least 10 kids social distancing and knowing that they'll run around trying to play with their friends and not being able to? And then I feel like that's another thing would it traumatize them more? How are they going to keep them away from each other? How are they gonna sanitize, especially if they're gonna go from one play area to another play area? Is that gonna be sanitized right away before they do go in the other play area? How are they going to teach them? How are they going to keep them still? It's really like kind of a concern matter because there's a lot, like we're worried and we're scared. Like there are all these guidelines and demands that we have to have our child do going towards daycare and opening up. And it's just like, is it worth having them go back and risking them to this whole pandemic, whole virus and everything that's going on?
Yeah, and I think that's an excellent segue to our next guest because we are trying to figure out this balance between being practical about caring for young children and keeping everybody safe. So we are honored to have Dr. Faye Holder-Niles with us today to help us work through this and how we strike this balance. Dr. Holder-Niles is a primary doctor at Boston Children's Hospital. She provides care to a large patient population in the city of Boston. She serves as director of the Primary Care Asthma Program and is medical director of the Community Primary Care in the Office of Community Health. Her work broadly emphasizes engagement with innovative programming towards reducing health disparities and improving the lives of patient families across the city of Boston. In this role, she works with local community health centers and Boston Public Schools to support initiatives and educational engagement and activities across various health-related needs. Boston Children's Hospital has been involved in many initiatives to support families. These include work with early childhood focused programs, school-based behavioral health initiatives, and most recently, and pertinent to our conversation, a review of the recent ECC guidelines. Dr. Holder-Niles will share more about some of the ways that Boston's Children's Hospital is contributing to this work during the pandemic. And we're very grateful to have you with us today. And I want to ask you, as the state moves forward with reopening process, a lot of childcare providers are eager to know more about COVID-19 and how they can keep children safe. Can you share with us some of your thoughts about the impact of this virus on children and the ways in which Children's Hospital is working to support the community around these issues?
Thank you so much, Congressman Clark. I'm thrilled to be here today to share with my fellow presenters. And I think, you know, the parents have really brought home sort of a lot of the key issues with this pandemic. You know, the impact of COVID has really been substantial for both children and family. And it's true what they've said, you know, certainly for kids, they've really experienced major disruptions in their routine healthcare, their education, and their social emotional development as a result of the pandemic. And you know, a lot of what is being said is certainly resonating with us in the medical community as we think through and are really looking for ways to support families and support care providers as we move to this next phase of reopening. I think for us in Massachusetts, you know, we've certainly, kids overall have done very well or relatively well, which is consistent with what we've seen across the country compared to the adult in their families. As we know, you know, a lot of adults, certainly those who are older with chronic medical conditions or belong to racial and ethnic minority groups, have had high rates of hospitalizations and poor outcomes. But I think the good news is that for kids, we see that they've required fewer hospitalizations and ICU care, which is certainly reassuring for us. That said, there's certainly the kids who may be at higher risk for being ill if they develop COVID, you know, including certainly kids with moderate and severe asthma or respiratory conditions, if they're immunosuppressed, and or infants who are less than 1 year of age. And just to briefly also mention the evidence linking COVID to the new multi-system inflammatory syndrome in children that can be life-threatening. You know, and as a hospital, we've certainly seen and are managing this and really are eager to partner with the state and the community to really start to address some of these concerns and figure out how we can really use some of our resources to support families and care providers as we move to the next phase. I just also want to say that, you know, the pandemic is really, we appreciate that it's had a major impact on the social, economic stability of families and in our community. And at Boston Children's, you know, we really recognize that it's so important for kids to have this early access to high quality care, early childhood programming, you know, some of the social development that you mentioned, being able to see their peers and go to daycare, certainly. And we really support and agree that it's so critical for families as we move forward that they have access to these childhood services. In terms of our work at Boston Children's, we also have had a longstanding history of working with many early childhood programs through our Determination of Needs program in our Office of Community Health. You know, we currently fund 12 initiatives with early child care providers set in the city of Boston, 7 of which provide direct resources to early child care providers and support. And with the pandemic, we've really been supporting our grantees to really pivot their work to really support the immediate needs of families and early child care programs, including online training around social behavioral learning, response to trauma and the stress of COVID, and are really eager to work, you know, with the state and other organizations to really provide guidance in terms of medical information and supports as families in early child care programs begin to reopen.
Oh, that's terrific. Thank you. And we'll look forward to learning more. I want to introduce our next guest. We're very grateful she could take the time to be with us. She is EEC Commissioner Samantha Eigner-Trewargy, and she is the Commissioner of the Massachusetts Department of Early Education and Care. We don't want to fall into the acronyms too early in the day. From the classroom as a preschool teacher to Capitol Hill, Samantha has been a fearless leader in advancing federal and state-led initiatives to develop an early childhood strategy that is innovative and focused on quality and access. As commissioner, she works to support the healthy growth and development of all children by providing high quality programs and resources to families and communities. We're so grateful you could join us. And, you know, I hope that you can identify us as for us as commissioner. You've heard from our parents, from Lynette and Katie, from Dr. Holder Niles, about what are the challenges you're facing as you are trying to bring all of this together, balancing the concerns that parents have about affordability and safety and access. Providers often have about their own safety and how they're going to meet a bottom line when we know that in the best of times, their margins are thin, and make sure that we are also prioritizing public health in this time of pandemic. So not an easy job. I'm sure there are many challenges, but how are you looking at this, and how are you approaching bringing all these pieces together?
Absolutely. And thank you, Congresswoman. I think this is such an important conversation for us to be having. And I think I grew up in your district, actually, and so am excited to be back, but have been gone from Massachusetts for many years, and just came back to this role in August, and certainly not the adventure I thought we'd be having within my first year. I can guarantee you that. But I think, as you pointed out, is we are in the midst of a situation, and the pandemic has highlighted the vulnerability of the industry and the field of childcare that existed before we headed into the pandemic, and are exacerbated by the realities of trying to grapple with the public health and the child development. And as you pointed out, I think I can tell you that as a former preschool teacher, I was not, I think constantly, and I, you know, am certainly heartbroken by the fact that we are in a place where, you know, children haven't been able to have those services that you, Katie and Lynette, described, that are so vital to their growth and development, and that we've had to make sacrifices as a Commonwealth through this, and that childcare has been no different than any industry, of having to really think about how we make sacrifices that would keep the public health priorities in mind. I am thrilled to be in a position where we're headed towards reopening, although certainly in a unprecedented time where there is no roadmap and we're all building it together. So grateful for the partnership of our health colleagues at Boston Children's Hospital, the Department of Public Health, of trying to develop guidelines and requirements that would help make sure we are balancing the health and safety of our children with what the experts in our field know children need every day. I think that as we think about balancing those, there are a few things that I did want to highlight. First is that, as you pointed out, that this is a workforce that was you know, in need of support prior to the pandemic, and we are in a situation now where we have a workforce that, in order to meet the economic needs of the Commonwealth, we do need them to come back and be our caretakers and know how to change their own operations on a daily basis, to help encourage the kind of practices that can keep children and families safe. And we know that they themselves, many are vulnerable, and from communities that are vulnerable to the virus. And so making sure that we had the guidelines in place that helped keep our workforce safe, that as essential workers coming back and making sure they could be the caretakers for families who are needing to go back to work as well. I think second, and highlighting what Lynette and Katie said, is that there is this balance between the need of families to have childcare and the fear of making sure that childcare can keep themselves, families, and their children safe. And I think that this is where we are trying to strike the balance of making it feasible to operationalize and open up childcare, and knowing that is going to take shifts in our daily activities, in our facilities, in the configuration of the facilities, to make sure that we can minimize the number of contacts a potentially exposed individual has, and the number of close contacts, the proximity of kids that is just not where we, as a former preschool teacher, I'm the one who was always saying, get down on the ground, talk to kids. And now we're saying like, okay, a little distance, right? We would have encouraged things like floaters between classrooms to help make sure teachers got the breaks they need and could be present. And these are all things that we're having to rethink in the short term. The other thing I will say is that we are really looking at this as a 2-month solution right now. We don't know what the future is going to bring, and we know that parents are having to, as Katie pointed out, having to negotiate their own reentry to work and what that means in terms of working from home, changing schedules, what affordability means for childcare, given all of that. And I think we do not intend to go and measure children's distance and use it in any punitive way. We do want to make sure that we are providing the guidance to professionals who are feeling their own anxiety during this and having the opportunity to understand what kind of practices can help keep these environments safe so we don't see an outbreak of COVID in our childcare centers, given that the research is still evolving very quickly in this realm, and we're learning new things about this virus consistently. And so while we don't expect it to be punitive in any way, and we will not be going and we're not going to be the hugging police, I can promise you that. We are going to make sure we are trying to support providers, that we are providing the systems and where they can make these really critical decisions on a daily basis, and continue to evolve with them and learn as they do on ways that we can continue to improve and support and provide flexibility, so we can all really try to navigate these uncharted waters together.
What are you seeing, Commissioner? I know a lot of parents are anxious not only what the day will look like, what the facilities will look like when they get back to childcare, but will it be available? Or do you have any indication yet of how many childcare providers are going to be able to reopen soon under these guidelines and with the economic conditions that this pandemic brought on them?
Yeah. And, I think this is a great question. And I think the entire country is grappling with this question. The childcare landscape before COVID was state by state, and trying to understand how we could support parents to make this very personal decision. None of us really know, state really knows what to expect when we go in. So our reopening process, one of the really important components of this was trying to better understand the landscape so we could make accommodations for our most vulnerable children, so we could try to understand where we would have demand from parents, where parents would be able to come back, because we know that the funding model for most of our providers right now is a per child model. And if you don't have enough children, that becomes a very challenging business proposition, but it is a critical infrastructure we need in order to stabilize the economy over the long term. And so our reopening process to that point was we currently have a intent to reopen form out with all of our providers, with an idea that we can get a better sense of what is that going to look like in Massachusetts. We know that we are one of the hardest hit states in terms of the COVID virus. And that is having an impact, a very personal impact on both our parents deciding how to come back in to the childcare system, into a group care setting where you're dropping your most precious commodity off with people who you have to rely on to maintain very rigorous health and safety standards, and to our providers who are deciding what is their own, how they can navigate their own business through this new time. And while we want to support in any way possible, and providing the guidance and making sure there are resources as much, and thank you to Congress who helped us provide some of those resources to be able to get out to the communities, that we know that this industry as a whole is made up of a myriad of very personal decisions between parents and providers, and that we are trying to assess in an aggregate way as much as possible. Other states have seen really low utilization rate in the first uptake of from parents, and so we do anticipate some of that. And other states have also seen a slow reentry for providers, and we expect to see some of that. And exactly what that will look like, we hope to have the data by the end of the week as we ask providers to tell us what conversations they're having with their parents, what conversations they're having with their workforce and their own families, and at what pace and scale they feel comfortable reentering the market.
Maybe you could answer.
Clarifying question.
Oh, sure. Katie, go ahead.
Commissioner, when you're talking about child care centers, so I have a school-age child and one entering school age. So are we talking home daycare centers and preschools and camps, or camps sort of a different conversation? Because I have one in the preschool environment, but my camp age child, I'm extra worried about, because typically we would go from camp to camp, different places, different weeks, which obviously in this environment is extra concerning from a health standpoint.
Yeah. So this is the beauty and the complication of bureaucracy. Those are all, we at EEC oversee the childcare centers that do include, childcare providers that do include the centers and the family childcare, but camps are regulated by DPH and overseen by local boards of health. We did our best to make sure that the regulations and the requirements and the health standards were consistent across all of those providers by working closely with DPH and with DESE, the Department of Public Health and the Department of Elementary and Secondary Education, to make sure for families like you, Katie, we didn't want you have to think, okay, in a camp we need these requirements, and in childcare, so one child needs these and one child needs these. We were trying to make it as seamless as possible. But in terms of a provider's day-to-day decision to open or not, the camp is making that in a slightly different context than the childcare center, because they are overseen by a different body. So I don't have the answer necessarily for your camps, and we wouldn't necessarily get that level of aggregated information for the summer.
Question. So what would happen, because I know that there has to be only 10 children per group in the class. How do parents know, because usually there's childcares where they have more than just 10 children in a classroom, and they have so much space in the whole entire building. How will they know that their child could go back to school, or they are able to go back to childcare? Would it affect the people that are actually paying with the voucher or not having the voucher? Are they going to be able to would they be able to go and bring their kids to childcare? I know that's another concern where, including myself, I do need to work, and there's other parents that do need to work. And then if we cannot get our children into childcare, because the minimum is 10 children per group, and there's not that much space, how is that going to help or fix, or what are some ideas or backup plans for where us parents could be able to work and be able to pay rent, be able to pay bills, and not worry about not being behind on rent and being behind on bills? Because that's another really main concern, especially when jobs are opening and they're trying to get us all back in, but then most childcares won't allow it.
So I'm not sure that childcare nodding allow it, and I'd love to, if there's an issue with your childcare not allowing to come back, we'd love to talk through that. I'm going to do that offline. In terms of the access question, this is a really big question. So there's a few things that we are trying to work with, and keeping in mind we have over 8,000 childcare providers in the Commonwealth, each of which are in a very specific location and configuration and family, if it's a family childcare, home daycare or family childcare provider, that they are in their home. And so asking them to reconfigure their home is a very different question. And we know families are across the country seem to be gravitating towards those smaller settings, which have a very different way of operating, and we need to be respectful of that. And so there are a couple of things that we're suggesting people do during this planning period to talk with parents. One is, because we are limiting, as Dr. Holder-Niles said, that from the health perspective, really trying to think about how we limit contacts and really think about the protection of the virus. Things like shared spaces, I think Katie referenced, of like, or said, how do you clean between going in between spaces, that how we, we know that the use of shared spaces will go down. So many providers have things like a gross motor room where children may go when it's raining outside and use shared spaces. That would be very difficult to do when you're trying to disinfect everything that children may have touched in between. So we're encouraging them to think about using those as additional spaces for the summer to help where we might be able to find expansion. Thinking about additional capacity that they can bring on to help expand spaces so the impact on families will be minimal. But second, to really have conversations with families, because I think, as you all pointed out, that jobs are looking different for the summer than they did in January. And so understanding from employers, I know the administration has encouraged employers to have people work from home, and that is going to mean different kind of requirements for childcare from families. And so really doing some of those intimate conversations that we know need to happen between a provider and a parent to understand how much of a capacity strain there really will be in those initial weeks and months. As I said, we're looking at this as 2 months at a time, and so really anticipate being responsive to the public health landscape and the data, and really hopeful that we will be reconsidering some of these ratios and group sizes and requirements as we look towards the public health landscape changing as well. And so we are looking for that, and then helping providers understand where the options, ensuring that those that are serving our most vulnerable families are opening back up so that they can be available for families going back to work, because we know that that's a tension, and then making sure that those that need different care or aren't available, we will have additional flexibility in our subsidy vouchers that you were referencing, that is supporting individual families to attend care, so subsidizing the cost of care for an individual family by the state. And as we do that, we'll be making sure there's additional flexibility so that they can accommodate a different work schedule, accommodation schedule, childcare schedule. But ultimately what we know is that this is 55,000 parents with individual relationships with individual providers who are going to have these conversations, and that we hope to provide enough guidance and roadmap, but we'll have to deal with, much like we all have through the crisis, on a case-by-case basis, as we recognize that there will be challenges that none of us have ever confronted before, that we're problem solving as quickly as humanly possible as we encounter them.
One of the questions that we're getting a lot, Commissioner, from providers is when they can expect some of the supplementary materials, the templates, the frequently asked question answers, so they can begin this process and get reopened as quickly as possible.
Yeah, so we did release, I think, a lot of clarifying frequently asked questions, and for our small family childcare daycare home, some translation of the requirements of how that would be applied in a home setting on Monday. So hopefully we've heard a lot of positive feedback of that, helping clarify things like, I know you mentioned masks. We are not requiring masks for children. We are not going to, be there with measuring tapes to make sure 6 feet apart. None of that is happening. This is about we know that many providers are nervous about their own health. So making sure that there was the flexibility for everyone to accommodate their own community. That was released on Monday. We will be releasing templates for the planning as we move forward by the end of the week. And then next week, we will be providing the additional policy guidance so that people can open up and give their plans to us to be able to open up, knowing what the policy guidance is around the subsidized families or other space requirements on there. So as quickly as we can create them and finalize them and make sure that they are accommodating the public health lens, we are trying to get them out to the field and make some of that, but also know that this will be an incredibly iterative process as we all learn new things every day. And so as Dr. Holder-Niles pointed out, the research is evolving and we are learning new things and trying to actively integrate both where we can provide new flexibility for providers, but also where we know other additional impact and we might need to think about the public health parameters as well.
And to add to that, I just want to say from sort of the medical public health perspective is certainly there's so many challenging questions as we try to figure out how to do this and reopen safely, keeping kids safe, keeping providers safe, and feeling safe as a community. And certainly wanted to reiterate that from Boston Children's is certainly, thinking creatively in terms of how we can work with the state, how we can work with the care providers to support the development of or develop really good health and safety trainings and webinars, because we want families to feel comfortable, with whatever procedures are in place and that they're good health standards to keep their kid as safe as possible once they go. We certainly care about the health of the providers who are going to care for these kids, particularly because they're adults and they, are at higher risk. So to really help create these materials to support them. We're also interested in continuing to support the workforce with our community grant funding as well, and really starting to think through some innovative ways that we can explore new funding to support our care providers or early educators to really to help support and ensure that they have these systems in place and really have a good plan and materials and supplies to really support the reopening and the guidelines that were released by the state. And certainly I think other things that we're thinking of in addition to sort of, basic medical review of COVID, the symptoms, what to look for, the best prevention strategies. We're also thinking in terms of, partnering with our community health centers. Children's have a large network of affiliated community health centers who've really been at the front line of this and deep in the communities in terms of serving families and providing unmet needs and food and other resources, but to partner with them so that they can also support care providers in the community and in the neighborhoods in which they live. So really thinking through how we can also support and, to help sort of ease the burden as we all try to figure out some of these tough questions. And the other thing I would add is that, pediatric offices are open and, the medical home is such an essential component of the social, emotional health of kids, supporting families. We're slowly reopening for to increase access for routine care, vaccines, supporting families' behavioral health needs, their mental health needs. So I also encourage you to have these discussions as well with your pediatrician and your medical home, because your medical home want to be part of this discussion and to really ensure that families and kids are safe as we move forward in this reopening process.
I have a question for kids with high risk and with a high risk fatal health disorder. How is it going to look for them and the parents? How is it going to look for their stress and their worries when it comes to their kids with high risk health issues, including when open childcare and reopening up more clinics for them to be able to see their physician, be able to get their immunization shots? Like, how are they going to be able to stay safe and not get a virus or get any other type of not bacteria, this criteria, they would have to be.
No, that's a great question. And I think it's a concern that many parents face right now, because I think with the emergency shutdown, many of the offices were closed or limited only to sort of emergency care. But what I can say, certainly for Boston Children's, and I'm sure and imagine this is probably true for most offices, is that there are a group of folks getting together, infection control specialists, physicians, and other staff who are really thoughtfully thinking through how can we get patients back in the office safely. We want patients to feel safe. We want it to be safe. And we really want to ensure that they can have access to those vaccinations. They can have access to caring for their chronic medical problems, for kids with asthma or respiratory conditions, ensuring they're on their medications and they're doing well, even without COVID. Those are things that we really care about, and we're happy to partner with families and work with them in innovative ways as we're reopening the offices to really get families in and to be able to do that. But excellent question, and I think we're all really trying to work through those kinds of questions.
How would childcare also work with children with high risk, and public schools? How would they be able to work with children that have high risk and are so delicate to viruses, flus, anything that you could think of that they could just, because my son's immune system is very low, like he does not have a strong immune system, and it's very stressful and frightening for him to go back into the public and going back into school and going back near childcare. And it's just, what is it that we can do for just not only myself, but for other parents to feel assured that our babies are going to be safe?
Mm-hmm. Mm-hmm. Yeah, I mean, I think this is why making sure that we did have guidelines in place that were available not only to providers, but also to parents, so they could understand what guidance and parameters were being set for providers to be able to keep children safe. And I think you pointed out that vulnerable children were attending childcare, medically vulnerable children were attending childcare previously. And so we know that childcare does have a lot of these safety precautions already in place. And we know that our providers are prepared and able to step up and meet the even increased requirements we need to have during the increased public health situation we're in, and crisis that we're in. And as we go through recovery, I know that while we have to march towards the reopening and making sure we set out those requirements, that it's going to be incumbent again on you and your provider, on every family and their provider, to have these conversations to make sure that everyone knows the mutual responsibility we all hold here to keeping these spaces safe and making sure that they don't become vulnerable to the virus. And that is not, as Dr. Holder-Niles pointed out, it is thinking about our workforce. It's also thinking about the other families in childcare and really understanding those other families, as I referenced, those that are being raised by grandparents or have vulnerable family members at home, medically vulnerable family members at home, and making sure that we all understand that childcare is one of those things that does require the social compact to all be able to make sure that we are all doing our part to keep those environments safe, because it is not only about me and my child, but it is about the group and all of our children being able to be in a group care setting again, for all of the reasons you pointed out, both economic and child development and all of those things that we want for children and families, but knowing in this really difficult public health reality at the moment, that is going to take all of our own accountability to make sure we're doing our part to keep those settings safe for children like yours. And so I do have
along those lines, we have a question from the chat room, and they're wondering if a child does become sick at in a child care setting. Well, I've heard that child will, potentially be isolated. There's some concern on how that will work, but will the entire classroom be sent home or just that child?
Yeah, so this is a case-by-case basis, and one of the most difficult reasons of starting up a system at scale again that has the kind of supports to make those decisions. You know, it's one thing for us to do it for an emergency childcare system with 300 or 500 programs where every call could end up in my on my phone line directly. Another thing to do it when we're talking about thousands of providers who will need this kind of very quick, rapid response answers to situations they haven't seen before. So there's a couple things we're doing on that end. One, the reason why we are asking for plans and planning to happen and making sure that people are looking to make sure you're isolating children not as in a corner by themselves, but really in a way that is both developmentally appropriate and protects the rest of the classroom, that we will need to make sure that those plans are in place. And the number one thing that helps people through a crisis is having planned for it. And so it won't be perfect, but we want to make sure people have thought through what happens, who's responsible for that child, how do you not have them for extended periods of time with other children, because to answer your question of what happens to the rest of the classroom or the rest of the center, it is going to be a conversation with our local boards of health who are going to be able to do the kind of contact tracing that helps make the decision about who else is at risk, who else is exposed, and what needs to happen with everyone else. I tell you, when we first March 18th, when childcare closed and we opened at the emergency childcare system, there wasn't time to plan, right? We knew we were in a crisis, we had to close down. And so our planning was to really call us and help us navigate that. And we've learned a lot about what needs to happen for that. That in order to do that, we need to have programs that have thought through who is the point person who can quickly and definitely take care of this situation, and where you can appropriately care for a child without putting them in close contact with other people in case of a risk to exposure, and then quickly call the local board of health and have them walk through the series of questions that understand who else might be at risk and how do we make some decisions around that. We do know that local boards of health have varying levels of capacity as well, and they are dealing not only with childcare reopening, but all of industries in their own throes of reopening. And so we're working on creating a childcare specific hotline where people will be able to call if they're having trouble getting in with their local board of health and be able to call that. So those are some of the preparations we're doing now to make sure that in those cases where that does happen, we have the supports and the plans in place to make sure that people can address those issues very quickly. But it really will have to be a case-by-case basis, because we know from our emergency childcare, there are some times where we have exposure or a sickness that it happens, and it's very self-contained, and that is one classroom, and sometimes where it has spread throughout the center and everyone needs to be quarantined, and we need our health experts to help make those decisions with us.
Thank you for that. I also wanted to get your take on one of the pieces that I hear a lot of anxiety about is rising costs of tuition. And much like Katie already put forward, we are not only dealing with some of the highest costs of childcare in the country here in Massachusetts, but now we are asking parents who are often coming out of very difficult economic circumstances brought on by this pandemic or exacerbated to look at potential rises in tuition as providers have to adjust to sometimes dramatic reductions in their income in order to cover costs, as they are not able to use floating staff, if they are have to expand a space, buy sanitizing equipment, the list goes on. Part of the work that I'm doing in Washington is to try and address those costs for providers, very much with an eye on keeping tuition affordable. We had an affordability crisis before this. It is not going to get better unless we're very proactive. What is the state doing to partner? Are you using any of the $46 million that you've already received? We hope there's a lot more coming to address the cost of tuition for parents.
Yes, absolutely. So just to give you the size and scope of the Massachusetts system and what we're talking about when you address the tuition-based system, I think a lot of times the child care block grant from the feds has been a huge asset for low-income working families. But to kind of contextualize that in the overall system, we have just over 8,000 child care providers in the state that have a capacity to serve about 250,000 children on a daily basis. And the current subsidized system is about 55,000 children. So about 20% of the overall system when we look at what we're talking about. So Congresswoman, as you're talking about that tuition paying, that's the other 80% of the system is paying a private parent paying fees to access childcare. And I think that we know that like every industry that is reliant on private fees, that is a huge vulnerability post-COVID. And as you pointed out, was a fragile reality before COVID. And so really trying to be able to focus on that. At this point, again, I think there's a couple ways we're trying to mitigate that. We know that there has been massive revenue loss to this industry through and an industry that also is a critical infrastructure and critical enabler of the economy through the closure. And so we're looking at we were lucky enough to be able to sustain as a state, sustain funding to our subsidies through the closure and make sure that that revenue loss wasn't bared on parents or on providers to keep our infrastructure intact as much as we could. We're excited about the $45 million, or $46 million, $45.7 million to be exactly precise, because we do intend to put that out to help providers restart over the summer, particularly targeting those that are serving our most vulnerable families, knowing that, to your point, it is a wonderful investment from the feds, but is a start to a much bigger need for stabilization across the country right now. And so as we look at that and are grappling with what we're doing as a state, is trying to make sure that we are providing some flexible operational dollars with that $45.7 million, targeting those providers that are serving our subsidized families to ensure that the infrastructure, as much as possible, remains intact for those vulnerable children and families who are reliant on our subsidies to be able to access care. After that, I think we really are trying to get as much data as we can in these initial weeks so that we can try to be as strategic as possible and partner with you at the federal level to understand what kind of investment would help us sustain an infrastructure that is wholly reliant on in a per child funding model, which what we know is going to be impacted for the next year is how many children are able to attend, whether that's because of making sure we have enough space so that children can spread out and aren't overcrowded, or making sure that families feel safe enough to come back, that is going to be a fluctuating target over the course of the year, and trying to get some data so we could provide some actual real impact supply and demand impact numbers, and be able to be creative thought partners with you, with the state legislature, and obviously with the administration as we think about how we're going to solve this issue over the next fiscal year.
Yeah.
Sorry.
Lynette, do you have a question before we close?
Yes, I actually have another topic question. What about the children on the spectrum? Like, how are we going to help the parents with the children with special needs? And how are we going to be able to keep our kids that have special needs that in one spot, isolated in one room, and not being able to move from one place to another, or helping them? Because I know there's some kids that are on the spectrum that cannot stay still, and in one certain location, it's not helping them, and it's just gonna, I feel like that's another major concern with, I know a few family members, including myself, my son's learning disability. How are we gonna help them not stay, and how are we gonna help them focus and not have a panic in class when it comes to not being able to move to another location, or not being able to do this?
Yeah. Well, and I just want to clarify, Congresswoman, when you were asking about the sick children in particular, we are not endorsing isolating children in any sort of way. This is a, when there is an exposure or a potential exposure, to make sure that child is not isolated in a way that they can't talk to anyone else, but isolated in a way that they aren't in close proximity to anyone else to be able to risk exposure of the virus. I think, and I'm interested in hearing Dr. Holder-Niles' comment. I will say just, you know, we have a lot of really skilled professionals in the field, and I'm very hopeful that they will be able to really help navigate these very difficult day-to-day decisions that'll have to be made. So I'm interested in hearing how you're supporting them in doing that.
Yeah, Faye, maybe if you could weigh in on that. I think it is an issue that I've heard so much about from parents who feel very isolated. It has been very difficult to lose the support of either programming through childcare, through their schools. Maybe you could address that briefly.
Sure, absolutely. So Lynette, that's a really excellent question. And it's certainly something that we've also seen during the pandemic with kids being at home, and it's a new and different way of doing things, particularly for kids with special healthcare needs, including autism spectrum disorder. I think, you know, Boston Children's have worked a lot in the space of behavioral health supports, including a lot of recent online trainings that our staff with the Boston Children's Neighborhood Partnership have put together, you know, a series of resources and online training for families, for early educators, really addressing just that, right? Sort of the social behavioral needs of kids. You know, kids are gonna need a lot when they go back. They're gonna need to be safe, but but they've missed their friends. It was different. It's, you know, things are gonna be different. So we're happy to make available some of those resources for families, for early educators. We also have the Brazelton Touchpoint Center, which, you know, have a lot of deep knowledge and experience working with families and working with early educators around some of these similar things. Briefly, during COVID, you know, they worked with the Sesame Street programming to offer national webinars, really addressing some of these things for these development, navigate this are available, and we're happy to partner with the state, or we're happy to partner with early educators and families to really figure out how we can sort of walk down that next line and next step to ensure kids are doing well.
And we are working, Susan, that we are working to make sure that those are all available to our providers and to our educators on our portal, that our Smart Start portal, which is where people access our trainings, because we know we have such wonderful partners in Massachusetts who are such experts in and experts in trying to navigate this as well as we are. And so I'm really thankful for being able to leverage that as we move forward.
Well, I'm really grateful to all of you for joining us today. I know that we have to end this conversation for right now, but this is just the beginning of talking about how we are going to address these issues and the childcare system that we want to build. We have had many, many comments and questions come in on Facebook from providers and our early education professionals, and we are taking note of those, and we will get you answers as quickly as we can. So if you didn't hear the specific question come up, we are writing them down and make sure that you get the information that you need. And, you know, as difficult as this is, the real barriers facing parents and providers, this is also an opportunity. It's an opportunity to see the child care system for what it is. It is an essential part of our education system. It is an essential part of our economy. And we have to be bold and really take this time to address the fact that child care providers are very low wage earners frequently. And yet this remains a very high price point for parents and families. And come to see that childcare, while they are personal decisions for families, that this really is a public good, and that it is long past time that we make the investment in it that is warranted. So I hope that this will be, with this pandemic and the pain that it has brought, that it is also time to recognize childcare for for what it is. It is essential. Our child care providers are essential workers, and we have to start making the public investment in it that reflects this critical role in how we are going to reopen and rebuild our economy and make sure that every child has a great start in life. So we know that there are many challenges ahead. I'm so appreciative of all of you for your input and your expertise, and we look forward to continuing this dialogue. Thanks everyone who joined us today.
You.
Thank you.